Hello, everybody. Welcome to Project Next. This is Sarah Blessing, and we're doing a mental fitness with Coumba Kebe. She is an expert on public health and home health, and she is also running for State House in Indiana. And we are going to talk about what it is like to have healthcare in other countries. What is it like to have it in Indiana? What is it like to have it in other states? Why do we keep making it harder for Hoosiers and for people in the country? You guys, this is sad. You all saw the news. James Vanderbeek passed away a couple weeks ago. He was a famous actor on Dawson's Creek. He was Dawson, and his family had to put out a GoFundMe to pay for his treatment with cancer, which he died from. And now there's another GoFundMe to support his family. Eric Dane, another actor, just passed away from ALS, and his family has done a GoFundMe. These are famous actors living in America that still need help paying for their health care. What about the rest of us? What about the people that have diabetes that cannot afford their insulin? What about people that are dying in childbirth in America because of problems? We do not have to live this way. We do not have to live this way. We could elect people that are smarter, that understand these problems and can fix things instead of just blaming the other side. We do not have to live this way. So this is why I asked Coumba. She's been making posts on her social media teaching us what it's like in healthcare in other countries. So we're going to learn all about. I'm really excited to learn more from you. Coumba, how are you doing today, my friend? And thank you for joining me again.
I'm great. Thank you. Thanks for having me.
Okay, so just briefly, why are you an expert on this? Because you clearly are. You really kind of blew my mind last time you came on the show. I didn't know you as well then with your expertise. Why do you know so much about this?
So I have worked in the home care space for almost 10 years now. So I consider myself an expert on Indiana Medicaid. But my background is in public health. So I have a bachelor's degree in community health and preventative medicine, as well as a master's in health policy and management. And so working in both the home care space and having that background and that knowledge and understanding of public health as a system holistically has definitely given me a different perspective in how I think about our healthcare system. And let me tell you, it's when you have public health knowledge and you understand how things work in other countries, it is incredibly painful when we look at our current system, not just in Indiana, but across the country.
I feel like in this point in America, you have to be very, very wealthy for our health, if you have a health condition, for it not to greatly impact your life and your family's life. I'm watching The Pit right now. Huge fan of that show.
Oh, yeah, I've heard good things.
Season 2's out right now. There is a character on there that comes in and he has diabetes and he hasn't been able to pay for his insulin and everything. So he's been cutting back and it almost killed him. And he didn't want to stay in the hospital because he doesn't want to pay for the bill. And the hospital's trying. They're all working together to try, and they're lessening the bill by like half. He still doesn't want to pay for it. And so that mirrors such a reality. I see my friends post on Facebook that they are cutting their insulin medication so that they can afford to live and pay their bills and stay housed. And I'm just like, why is the richest country in the world doing this?
Exactly that part. Why is the richest country in the world not able to provide basic health care? Why?
Yeah, why? So I know the fundamental biggest reason is we, the people, have lost touch of our government. I realize that. I realize big companies, billionaires, and then we also don't always have the most intelligent people that we've elected to be in power and vote for us, and they can get tricked. I realize sort of the big problem of what's happening, that we've lost touch with our government on both sides, and everybody is upset with it. And then everybody's kind of yelling the solutions. We need to do this. It would fix everything. We need to do this. And there's really not a clear cut. We just change one thing and we fix the problem. This is a massive, confusing problem. I listened to co-founder and good friend, Dr. Tim Peck, talk about this. He's running for Congress, and so he gets asked a lot of questions about this, and it's complicated. And he understands things we can do to fix it, but it's going to be hard. And we all need to get on board Republicans, Democrats, Independents collectively to put humans first, to put Americans first, and it's just not happening. So I get that, but let's go into Indiana.
Mm-hmm.
Coumba, can you tell us what what is it like for Indiana? Because it's actually worse in Indiana than some other states across the country. Is that correct?
Very correct. Indiana has some of the worst healthcare outcomes in this country. When you look at maternal mortality, when you look at infant mortality, we have like the third highest maternal mortality rate, meaning more mothers are dying in that first year postpartum than, 3 to 4 other states, which is really bad. I mean, when you look at every healthcare metric, Indiana is failing. And then on the flip side of that, you have our state assembly, our Republican supermajority, who are passing bills and making policy decisions that do not help improve healthcare outcomes. In fact, it makes it more difficult for people to get access to care. For example, SB1 is something that I'm extremely fired up about right now.
So this is Senate bill. I just want to explain what this is. This is Senate Bill 1. Yeah. Our Indiana state House reps and state senators are in a session right now. It's a shorter session and it's about to end, and they're passing horrific bills that are going to hurt us more. And so SB1 means Senate Bill 1. It was passed this week?
I think it passed the House chamber again yesterday, last night. And the current system that let me just give a little background of what's happening in Indiana right now. So not only do we just have, problems to accessing health insurance. I myself am self-employed and I don't have access to health insurance because it's expensive, right? So that's one. But then we also have an aging population crisis, right? We've got 17,700 people on a Medicaid waiver waitlist. I mean, just last November, it was 13,000 and it's grown over 4,000 people. And part of this is because we have a growing aging population. This is no secret. It's been in public health data.
The baby boomers.
Other countries have recognized it and implemented long-term care insurances decades ago.
But you mean they made long-term plans for something? Oh, I wish our government could do that a little bit. Yeah.
And instead of focusing on, okay, how do we make sure we give people access to the care that they need to keep them safe at home? Because not only is it more fiscally responsible to keep people at home, it's the right thing to do, right? People want to die at home and get
it's cheaper. It's cheaper to keep them at home, and they're better. They're more comfortable. When you get older, you get more confused. When you put them in a hospital, they're more confused. Their chance of getting an infection there at the hospital increases a lot. Yeah. So being at home is the smart thing.
And you would think the state assembly would say, okay, well, we have a crisis. We have rural communities that are shutting down, that are losing access to care. So let's not try to make more cuts to Medicaid. No, that's the opposite of what they did. And what's so frustrating as someone who understands Medicaid is that they are spinning and creating this narrative of fraud that doesn't exist on the scale that they claim it does. Does fraud exist in Medicaid? Yes, it does exist. But you know who's committing fraud? Providers. Hospital systems, insurance companies, not individuals.
I mean, they're saying it's individual people. Yes. The people that we've, supposedly are their bosses. They're saying we're the ones manipulating the system, but actually it's not.
It's not. And what's really funny about this Senate Bill 1 that they passed is like, oh, we're going to do immigration checks because we think immigrants are taking advantage of the system. A simple Google search would tell you that undocumented immigrants do not qualify for federal benefits. So you know who this hurts? This hurts children, citizens of this country, who may be children to undocumented immigrants who are now afraid to go seek care for their children because of this additional check. It's like, are we like, what are we doing here, right? And so
I got to tell you a terrifying story, Coumba. This is terrifying. The people that are passing this, the people at the State House and the State Senate, the person that I ran against last time for State Senate, Karen Engelman, my friend Cheryl went up and spoke to her, I believe, last week to try to talk about some of the things she's passing. Karen Engelman was very unaware of the bad reasons why you shouldn't vote for things. She only believed the things her party told her. And so she was just spouting the fake things to Cheryl. And Cheryl was saying, no, this hurts children because this and this and this. And the conversation ended and Karen was like, well, I'm glad you stopped by because you really make me think. And it's like, You're definitely not thinking. You're just
Well,
doing
not
as
just
you're
not
told.
thinking. This is the consequence of not talking to people in your community. This is a consequence of not engaging with stakeholders. And you know what? Like, that's not a valid excuse, because there are
But
people like myself who
I'm
have.
telling you, it is not a valid excuse,
Yeah,
and it is the excuse they're using. They are voting bad because they are not talking to other people outside of their circle.
and it's
Yeah.
not for a lack of trying. I mean, people like myself, people in the home care space have tried to reach out to say, hey, we have a crisis, because not only do we have this wait list, but now we also have rural communities that are losing hospital systems because they are they rely on Medicaid funding. So if you restrict Medicaid funding, you're now hurting rural communities that are already struggling with healthcare challenges.
In my county, we have one hospital, Harrison County Hospital in Cordon, and it is probably going to close in a couple years. And the people that are running the hospital are acting like everything's fine, and we're like, well, that's not the way to save it. Like that doesn't help. You're not being accurate at how much money you're losing every year. Another thing is, like, so you mentioned you cannot afford healthcare.
No, I'm currently uninsured, so I pay out of pocket for like blood draws
So
and things
you
like
are
that.
a very healthy person. Tim Peck has taught me this. You are a very healthy person. We need healthy people to buy in to insurance, because that cost helps pay for those people that are not healthy, or that are getting older, or that have cancer, or having a baby. So whenever you cannot afford to pay into insurance, it hurts everybody. It hurts everybody. So that is another problem. The fact that healthy people are choosing not to buy insurance because it's too expensive, or they don't have a good option.
The reality of it, like being a small business owner, owning a house, like you've got a lot of other things. And so if it's more affordable for me to just like pay for my blood draws on my own, then that makes more sense, right? And so that's where we get to a point where it's like, okay, this is bigger than Indiana. It's a systemic issue. And in my opinion, there's no better time for us to challenge our, not just our local policymakers to think strategically about healthcare, but nationally. Now is the time, if there was ever a good time, to really push for the conversation of universal healthcare. And I'll tell you why we cannot even have a conversation about universal healthcare, because in this country, we're so focused on ideology, right? When people hear universal healthcare, they hear socialism. That's socialism. Socialism is bad. First of all, these are two different things we're talking about, right? We can't mix things together. When you talk about universal healthcare from a public health perspective, that is not ideology. That is just a simple statement that says we as a society have decided that having access to healthcare and not going bankrupt is a basic moral necessity. That is all it's saying. It's not telling you how to implement it. It's not telling you have to change from a capitalist society to socialist. Universal healthcare exists in socialist economies. It exists in capitalist economies. It exists in communism. It can exist in anything, right? And so when we're so busy talking ideology, that's where we get lost. Universal healthcare is possible in the United States if we wanted it to happen. There is just simply not a political will to do it. And that's we as a people have to push back and challenge people and elect better people who can have nuanced conversations and solve complex problems.
I'm glad you're saying this, because this is something Tim Peck deals with all the time since he's running for Congress as an ER doctor. He's challenged, why don't you support, is it Medicare for all?
Yeah.
He supports universal health care, and he says Medicare for all would bankrupt the country, and we're not ready for that, and we need to fix Medicare before we can do something like that. There's many problems with it. It's not just a blanket statement. It's way more complex. And that's really hurting our party. Our party's so like, take a purity test on the Democrat side. And if you're not 100% with this ideology, we won't listen to you. That's not going to get the problem fixed. That's not going to get you healthcare. That's not going to get my friends that need their diabetes medication, their medication at a fair price. So it frustrates me. We need to get smarter. We need to communicate with each other on our own side, and we need to collectively fix this horrible problem.
And I'm glad you said that, because that is something that is like deeply like challenging for us in the public health perspective. Medicare for all sounds great in theory because it does expand coverage. However, it is government funded, it is publicly funded, but completely administered by private insurance companies with not very many guardrails. And there are so many issues. For example, there's this like risk score adjustment thing in Medicare where if your patient is more sick, you get a higher payment. So what do you think insurance companies are going to do? Make someone more sick and their documents get a higher payment and pad their revenue margins. And so if we don't talk about that and come up with guardrails and figure out, okay, if we're going to have a combination of public and private, how do we make sure that it serves the people and not just funnel public dollars straight into private insurance companies? So Tim is absolutely right. Like, we cannot expand Medicare for all as is and just say that's it.
And even Bernie Sanders has come out and said that.
Have challenges with that talking point because it can be.
Yeah, Bernie Sanders has come out and said
it can be Medicare for all, comma, but we got to do this. Yeah.
We got to fix some stuff. Part of the reason we're not fixing it is my belief of what's really toxic in political parties, in both the Democrats and the Republicans, and it's the inability to admit our own mistakes, to be like, look, we tried to do something to help, but we haven't fixed the problems that arose with it, the problems that you're talking about. And we're never going to fix it until we can get better humans elected that they don't have to act like their party is perfect. And they can say, let's fix this stuff and let's get in there and let's work together. And then we also can't have a belief that the other side are monsters and are trying to destroy us and we can't talk to them. We've got to talk to the other side and be like, don't you want to help your neighbors? What if you get cancer? You might not be able to afford it. Like, don't you want to make it better for the people you love? And they say yes. And they say, well, let's come together. We're going to have to do that. So we have to stop the division.
And we also just have to admit that maybe it's time that we don't make billions of dollars off of people being sick in this country. Like, that's just so right of it, right? Like, I think part of the challenge is we do have private insurance, right? They play a big role in our economy. They play a big role in our politics. And so it's like, how long do we want to continue on with this idea that what exists today works? It just
Coumba, what if we gave incentives to these insurance companies for helping people get well and stay well? What if they made money for doing preventative things? Mm-hmm. What if we changed the system with just checklists on, let's change the goal here. The goal isn't for you to make as much money off of the sick patient that needs really expensive medicine. The goal is for you to stay healthy, and that saves everybody money, except maybe pharmaceutical companies. And like, if we just changed what the rewards were, what the money was given out for, and the government could do that. The government could change the incentives. That's something Tim has taught me. So yeah. It's not necessarily, in my opinion, the best solution isn't all of a sudden get rid of all private insurance. It's change the incentive services and fix the problems with private, have government and private let people pick and make it competitive again so that they want our services. So we're searching and not just trying to pick the best worst insurance. We're trying to pick the best great insurance. You know?
And here's the thing, I don't know what the best system is. I would be weary of anyone who can point to one system and say that is the best system. But this is where we can do our research and look to other parts of the world who are doing something well and say, what can we take from them? Because in the United States, we are so different from other countries. You cannot copy and paste a Nordic structure into our system. It's just, it may not work, right? But yeah. There are so many countries that have been doing universal healthcare so well for so long. Why can't we look to that?
And like, can't we just like use it as a guide and like just at least get something passed where we're making little steps to make things better for us instead of what's happening now? Things are getting worse. I don't know if you've heard this, but I've seen this from my friends and family, and I see it on my friends on Facebook where they're saying medication that used to be free or used to be $10 a month is now $200 a month or whatever. A lot of people's medication that they rely on to stay alive, it's essential medication, is now much more expensive than it used to be. And that's, I think, because of the national government, things that's happening with them.
Yeah, we don't have a lot of like negotiating power when it comes to drug prices. And so it's kind of like a free for all, I guess, for the lack of better words. And it truly is just awful.
Yeah,
And
my heart hurts
especially
for
for like
everybody.
people who are diabetic, I think people hear diabetes and they don't think of it as like a serious illness. I mean, most of these individuals are insulin dependent, meaning if they don't have their insulin, they could die. My mom has been
Yeah.
a diabetic for 31 years. She found out she was pregnant with me. And if it wasn't for insulin and some of these life-saving medications, like, I mean, you know, God forbid, we wouldn't know what her life would look like. But it's just like, these are serious illnesses and people need to have these medications. And so to charge an insane amount of money for something that someone needs to survive is just like incomprehensible to me, right?
Yeah, but
Um,
we've lost touch. They don't have any incentive to make it a fair, competitive pricing. And so clearly we need some changes. So, okay, you have been doing a series on different healthcares in different countries, and you're going to talk about three, I think, if we have time. You've got Japan, Iceland, Israel. Do you want to
yeah.
touch on those? Do you want to touch on Japan? What is it like there? What's different about it that we could maybe learn from?
What I like about Japan is a perfect like example to use for the United States because it's a capitalist economy, right? They are really big into tech, really, and their culture is actually like they have a massive corporate culture, and so like, I mean, just kind of like us, they take pride in work and career and things like that. So it's a very similar economic structure. And so I always like to use it as an example, like, look, this can exist here. So Japan has had universal health care. I want to double check my dates here, since 1961. So for a very long time. And Japan has the oldest population in the world. Just think about that. Because they have universal health care, they have like one of the best life expectancies. People live up to 84, 85 years old. Now, on the
Wow.
flip side, they have a massive aging population because people are so healthy, that is something that there's challenging that is a challenge for them right now. But they implemented long-term care insurance back in 2000 because they knew this was coming. And what I really appreciate about Japan is their funding sources for the universal healthcare. It's not just taxes. It's a combination of taxes, insurance companies pay into it, and then or employers pay into it, and the citizens pay into it. It's just not a massive amount. So everyone kind of has buy-in to
So
the
it's
system.
cut up into
Yes,
ways where everybody's paying, no one is paying too much.
no one is paying too much. There are caps on on healthcare expenses, so no one goes into medical debt, and it's pretty much medical debt is pretty much non-existent in Japan.
Wow. I can't even imagine that. Think about how bad medical debt is in
Right.
America.
And so again, when you look at the best ways to measure the health of a population is infant mortality, maternal mortality, life expectancy. So their life expectancy is 84 years, which ours is 76. So it's almost 10 years more.
Ours has been going down the last few years.
Infant mortality is 2 per 1,000 births, which is one of the lowest in the world. Meaning,
what is it in America?
Different states are a little different. For us in Indiana, I think we're like 6.5 to 7, which is really high. And it actually is higher for Black babies. And we can get into that too. And then their maternal mortality is 3 per 100,000, which in Indiana, it's almost 31. So it's not difficult to see that if a country has universal health care, their population is healthier, and in turn that rewards them in their economy. Because when you have a healthy population and a population that doesn't depend on employment for health insurance, people are willing to start businesses. It's not like a thing that people have to worry about. And like, it's so interesting that it's even like a question for us, because the benefits far outweigh and far exceed the downsides of not having universal health care.
And I'm sure they don't have the paperwork, the red tape that we have in America, that when I talk to people that are doctors, how frustrated they are at the amount of paperwork and approvals and all the stuff that makes everything cost more. I'm sure they've cut it down and their system works better. than
Well,
ours.
a lot of these countries that have universal health care, because they've simplified their process so much, they have great like digital it's just like a great digital process, and it's like universal. Like a lot of them use the same systems. Like, you know how, if you go to community health, you have like what my chart. If you go to another hospital system, you have another. Usually it's one integrated system, so it's cohesive, and you can go from physician to physician. That is something that Israel does really well. They have a very cohesive system. And a lot of the things what's really interesting, I think, is a lot of Americans get stuck on this idea of like, well, universal healthcare means an increase in taxes. Well, hey guys, I hate to break it to you, we're already paying for it. We're paying for that in premiums, we're paying for that in deductibles, we're paying for it in copays. In a different system, that money would just maybe look a little different, but it's not any more than what
It would
you're
probably be
already
less, right?
paying for.
It would probably be less if we changed the things that are not working for us. Then the amount we would pay into the system would be less, like it is in Japan. Right?
I mean, if you look at like Iceland, yeah, I mean, but if you look at Iceland, they pay around 30 to 35% income taxes. Don't you think we already pay that? And not just taxes, but in everything else that we pay for health insurance, like I said, like our deductibles, copay, like all of that is already something that we pay for out of pocket. It just is called something differently to make you think it's different and not taxes.
We all have this fear in America that we're going to get sick and not be able to pay. I have friends that should be retired right now that have working jobs as seniors to pay off their medical debt. I mean, this is the fear that it is driving our country. We're very upset about it, but we're not collectively coming up with solutions that would work. And that's one of the reasons I wanted you on today. Well, let's talk about what works, So Japan's system sounds good. You talked a little bit about Iceland's. Can you tell us a little more about it?
Yeah, so in Iceland, like I said, it's mainly funded through public dollars. So higher taxes, so 30 to 35 for the average person, but the higher income earners pay more in taxes.
Oh, we don't have that in America.
That's crazy. What a crazy idea, right?
The billionaires pay their fair share in taxes?
Private companies shouldn't get 50-year tax abatements. Like maybe
private companies shouldn't be considered as humans.
Yeah, so they pay taxes and they use that money to fund universal health care. Now, Iceland is a tiny country, but what I found really interesting about Iceland was if a citizen requires a service that they do not provide, like let's say it's an advanced cancer treatment or something like that, there are cases where they will fly you out to a neighboring country and provide the care.
Wow. Yeah.
So these are things that exist in other countries. And if you look at, again, their life expectancy, their infant mortality, their maternal mortality, some of the best in the world. 3 per 100,000 births for maternal mortality. Again, Indiana is at 30. Infant mortality, 2.6, while Indiana is almost at 7 per 1,000 live births, and 82 years life expectancy compared to our 76. I mean, it's just... the data doesn't lie, right? The proof is in the pudding. And then, the reason why I like to talk about Israel is that it's impossible to talk about universal health care and not talk about Israel, simply because Israel receives the most amount of taxpayer dollars than any other country in the world from the United States for their military aid. They've received over $300 billion since the 60s. So when you think about that, our country is telling us that we can't have universal health care. But the country that receives the most amount of taxpayer dollars for military aid has an incredible universal healthcare system. Can we just let that sink in for a second?
Yeah, maybe we should invest in American health, in our own health.
So, and I don't want people to confuse that with like our money is paying for their healthcare system. It's not, but it's just an example of where our priorities lie.
Let's look at how we're spending our money. Because when we say we can't possibly invest in American lives and make their lives better, well, then why are you taking our money other places?
While they have a fantastic universal
healthcare. They have good healthcare. That is a good point. Yeah. Wow. I want to mention, so I went to Austria when my 15-year-old was 7, and before I had the twins, and I'd never been to Europe before. And when we were there, my son got an ear infection, and you have to get you have to go to a doctor. We're in a different country. I'm pretty scared. I don't speak German. My husband speaks German. The family we're staying with, thankfully, we weren't like on our own traveling. We were with a family that lives in Austria that my husband's close with. And so we were like, well, what do? We have to help my son. He has an ear infection. Well, the mom, Gerhild, she calls a pediatrician, and I'm like, can we get an appointment? Because I'm thinking it would be really hard to get some person from another country and a quick appointment to get this ear infection handled. And they're like, there's no appointments. You just go to the pediatrician. So we just we went to the pediatrician. We signed in. We sat there for 10, 15 minutes with other people, with other kids and parents. They call Micah in. They quickly say, he's got an ear infection. He needs medicine. I give him my insurance and stuff, but nothing ever happened with it. I never paid any money for this doctor visit. Then they have us go to a pharmacy. The way you do the pharmacy, you didn't give a prescription and wait hours for them to call you and tell you it's ready. You just go and wait in line at the pharmacy. And as soon as you hand them the script, they make the medicine for you right there and give it to you. So that took like a little bit. That took like 40 minutes. It was mostly waiting in line. And then it was like $10 for my son's ear infection medicine. And then the government paid for it. So my kid had an ear infection in their country as a tourist, and they paid for I paid for the medicine, but they paid for the doctor visit that I quickly got. Also, the care was amazing. The doctor was amazing. The nurse was amazing. The facility was the most beautiful facility we had been in. They gave him a cover when he was laying down because he was so tired from not sleeping, and he slept at the doctor's table. And I was just like, well, this is different.
Yeah, exactly. And the same day appointment thing is pretty cool. That was something
it was called Come Now.
Yeah.
Come Now.
That's something that's like a thing in Japan too. Like you can just go pull up to the doctor and be seen pretty much immediately. And I think they've even started to try to think about ways to expand healthcare tourism because of that. But yeah, I mean, this is the reality that exists in other countries. And I'll tell you what, like, I mean, my parents are immigrants. And so, you know, this is one of the things that is just so fascinating to him. He's like, I just don't understand how we still are in the United States and we don't have universal healthcare or a better healthcare system. And it's just because I think a lot of Americans aren't aware of what's available and what's possible. This is all we know. And so we're kind of
told this lie. We're told this lie that we're the best country in the world and that we're the best in everything. Well, we're really good in some things, but we're not the best in everything. And it's a lie. And I think we take it personally when we're like told other countries do it better. And we need to not take it personally, and we need to fix the stuff. Because, you know, from when I was born in 1980 to now, when you look at the government, it's a lot different. When in the 80s and the 90s, and like government, even though you maybe liked one side better than other and there was problems, they were still collectively trying to make people's lives better. And it was happening. People's lives were getting better. And now it's not happening anymore. Now people's lives are getting worse unless you are extremely wealthy. And I would wager, even if you're extremely wealthy, your life is not getting better because you rely on the community and the community is suffering. So, you know, it is frustrating. And I think if we can stop being so freaking divided, if we can stop blaming the other side and admit that people that in power are taking advantage of our elected officials and making them more powerful, if we can admit that together and elect smart people like you into the state house and smart people like Tim Peck in Congress, we could fix this. It's possible, right?
It's possible. And let me tell you something even cooler is that some people think this is just a national issue and it can only be fixed nationally. It actually can be impacted locally. If you look at a state like Massachusetts, Mitt Romney was someone who, basically came up with a way to provide universal health care to citizens in Massachusetts. Did you know that almost 97% of residents have universal health care coverage in Massachusetts? And
I did not know that. Do you know what it is in Indiana? Because we have a lot of people that don't have health insurance in Indiana.
I don't actually know what the percentage is. I'm sure it's not great, but I could look into that. But yeah, so what they did, it's not like necessarily a government-run healthcare system. They just use the existing resources that we have basically helping lower income residents get Medicaid, and then making sure that they expand their home care program. So instead of restricting the home care program and pushing people into nursing homes, Massachusetts expanded the home care program and kept people at home and invested that money into Medicaid and other state-run, like grant-funded programs to ensure that everyone has coverage. And Massachusetts has some of the best. It has like a high life expectancy of 80 years old. They have a lower maternal mortality. It's still fairly high, just because in the United States it trends high. It's 16, which is half of what ours is, and their infant mortality is pretty low as well. And that is happening here in our country at the state level.
It makes me want to move to Massachusetts.
So it doesn't always have to happen at the federal level. We just need people who are willing to think differently about how do we leverage the current resources we have. Now, it's going to be tough with this big, beautiful bill that is set to essentially defund Medicaid over the next 10 years. But we
could elect people to stop it, right? We could stop that
Yes.
horrible legislation if we vote better in November. Okay, Coumba, are you saying in Indiana, let's say we get some good people elected, okay? You have a big chance of winning your House seat. You're in I think you have a chance of actually winning, which is amazing. You need to win your primary first.
Yes.
Let's say that we get, and then Will Coltrion, who I had on, I believe last week or 2 weeks ago, he's running in a race where he could win too.
Yep.
Let's say that we elect some great, new, fresh, smart people at the state house, at the state senate, and we start working together and we reach across the aisle and we talk to Republicans and we get some of them on our side wanting to make their own lives better and their family lives better. Are you saying we could pass things like Massachusetts and we could make our own things better? Because right now we're one of the worst states.
Absolutely. And in fact, I think it's going to be a requirement, because we are setting ourselves up for a major crisis with some of these decisions that are coming out of the state assembly. And so we may not have a choice but to sit down and work together and figure out how to solution for this, because we are already in some hot water in the healthcare space, and not just home care, but overall healthcare. So, and it's absolutely possible, just using the current resources that we have. We just have to figure out, okay, where do we want to invest our tax dollars, right? And currently right now we have like over $1 billion in our reserves. What are we saving this for when we have a crisis?
Why are we cutting everything when we have, that's wild.
And you know, it's very confusing to me, and it's very weird. And I think it's important that we really let people know how odd this is coming from the state level.
This is not a Republican or Democrat problem.
It's just
this is a people in power problem, because I know that in Indiana the supermajority is Republican, but in Indianapolis the supermajority there's more Democrats, and Indianapolis people are not being listened to. Just drive on the roads there; they're terrible in Indy. They're not being listened to as well, even though they're Democrats. They're not supporting public education, even though they're Democrats, and supposedly that's a Democrat value. So we're not saying one side is bad. Both sides have problems. In order to get elected, we have to pick a side. Well, we're on the Democrat side, but that doesn't mean we don't realize the Democrats are part of this problem too. And I just want everybody to understand this. We're not blaming one political party. I'm blaming both political parties, and I'm on the side that I think is a little bit better.
Yeah, I think and it is a responsible conversation to have, right? Like we collectively have to take ownership with where we're at the state level. But I do have to say, though, I think this is why it's important to have balance. When you have a supermajority, there is an echo chamber that exists. And the echo chamber not only impacts the party in power, but it also makes the other party that's the minority feel as though maybe you're crazy. I mean, I experienced that in my work, right? Like we are looking at each other and saying, this is crazy, right? But then when you look to policymakers, they're acting as if we don't even exist in the same reality. And so
there's no looking out and like trying to fix the problem.
Yeah.
They're just going along with what they're told.
And so
there's no accountability.
Yeah. And so it's like, okay, this is why balance is necessary, so that you have both sides being represented and the people being represented. And I think that's part of the problem. We're just
you're right. The problem is balance. We want purple. We want enough Democrats and Republicans in power and independents. If we get some libertarians in there, get some different voices compromising, holding each other accountable. And if they don't do a good job, they don't win their election. And we've kind of lost that with gerrymandering in Indiana. I know the race I'm running for state house is very gerrymandered, but at the same time, these lawmakers that are Republican are hurting everybody. They're hurting Republicans too. So how much hurt can they do to us in Indiana before we vote differently? Maybe this November will be the time.
Yeah, and encouraging people. And I think a lot of people feel a little bit like, while I feel like we are generating a lot of excitement this year for midterms, I do think that a lot of people just have lost trust, right?
Me
like
too.
I think I've said this before, like, hey, here are more people saying that they're going to run and change, the system. Are they actually, right? But I think that's where we have to do a good job of convincing people, like, hey, give us a chance. And if we don't do a good job, you can fire us, right? And I think that's where we have to empower people to remember that they need to show up and vote and make sure that their voice is heard.
But also, we can't fix it like this. It's not going to be fixed in a month. It's going to take years. It's going to slowly get a little bit better, and then a little bit better, and then a little bit better until your lives are better. And I think that they have a frustration with us because maybe they come out and vote and maybe their person wins, and then they quickly don't see the change, any positive change. And we have to realize this is hard. And like, just you getting elected alone is not going to save Indiana. It's going to be one piece.
We have to challenge each other. If we get the opportunity to say, we need to show immediate relief. And that's the problem too. Like, we can't just let people like say, hey, this is going to take time. Systems take time. We've heard that for decades. Systems take time to change. However, we have had countless opportunities in this last general session to pass bills that provide immediate relief. And we did, right? And so I think as emerging leaders, we have to make it a priority to say what is going to provide immediate relief to people so that they can see that you're working for them, right?
I like this take on it, because you're right. We could elect better people, hold the people accountable, and push out legislation that would help within a year. Like, you could pass something in January, February, March that gets enacted in like July that could make Hoosiers' lives better quickly. And that's sort of what we're going to have to do, honestly, because things are going to get so bad. I mean, we're just going to keep getting worse and worse. I mean, we're at a tipping point of so many people are suffering right now. James Vanderbeek, like I said, had to get a GoFundMe for his cancer. He's on a hit show, Dawson's Creek, everybody loved, I mean, so many people are hurting. We're going to have to do something. So hopefully, I did door knocking a couple days ago. And a lot of people I door knocked on had no idea who I was. They didn't really know what was going on in Indiana. They just knew that the system wasn't working. They were not big party, big loving of Republican, lovers of Democrats, or like, we don't like politicians. And I think that's what you're saying you're seeing too, right?
Well, and I always tell people I'm not a politician. I am trying to be a public servant. Like, I'm not entering this to be a politician. I didn't dream of being a politician my whole life. I entered this because I am a frustrated constituent. I know what it feels like to be ignored. I know what it feels like to see human suffering and see people in positions of power consistently ignore that. And I think we have to do a better job of just reminding people that public servants in office are not distant celebrities. They're not these people they are community members. They live in your community. They are humans just like you, and should be held to a standard to provide and to produce results. And we're at a transitional point in our state and country where people need results fast, and that's just the reality. And I think that's the challenge that we hopefully as leaders are going to have, as we
I looked up from the last Indiana session, 2024 session, the cuts to public health, and they were immense. I just researched it before I did an episode with a professor from Bloomington about public health, and I was horrified and oh, I don't know if I'm glad I know that now. And then you're saying this past legislative session that's about to end, it's doing more damage. Is that correct?
Yeah, it is. It's doing more damage. It's doing more damage to Medicaid. We're just pushing this narrative of, that doesn't really exist on the level. And I think that's part of the challenge is so many of these changes are justified by things that aren't true. And that's really frustrating from a public health perspective. And public health is just, the state of Indiana doesn't value public health as well as we should, given where we're at in our healthcare system and in the middle of this crisis. And unfortunately, I just worry that we're the state that's not going to do anything until we see negative impacts on a larger scale. And that's where we're headed right now with some of these bills and changes that they're passing. Because like I said, rural communities are already struggling, individuals are struggling, senior care space is struggling. And so, what we can do right now is continue to advocate and remind people that public health has a direct impact on not just the healthcare system, but, the protecting our hospital systems, because what people don't realize is if we overcrowd hospital systems with the senior care space, with the senior population, if mom or dad gets in a car accident and they need a bed in the ICU, what happens? This is the same thing that happened in COVID. And unfortunately, we didn't learn from COVID. The point of masking up wasn't to stop the spread. It was to slow it down, to give our healthcare systems enough time to breathe so that it doesn't spill out into impacting our general population as
and also to give the scientists and the doctors enough time to figure out how to treat this new disease.
Yeah. And so that's where we need to invest in public health, to not only protect our healthcare systems, but to educate other people. And this is why I always say, this is what got me into public health. It's this idea and this question of when does individuality end and community well-being begin? And we have to start thinking differently as a society, to be less about, well, this is what I want to do, this is what I want to do, or this is how it impacts me, or I don't care until it impacts me, and start to think, okay, this is a collective system, and we have to start thinking more from a community perspective to keep each other safe versus just worried about, well, I'm not impacted, so it doesn't matter. Does that make sense?
Yeah, that makes a lot of sense. And it's really well so. And I can tell from meeting you that you really care about people. In a way to care about people is to invest in public health. And I think that's one of the reasons why you went into this field. And then you see your public health that works so well if you invest in it being cut constantly in Indiana, and you got fed up enough and you're like, that's it. I'm going to run for state house. Maybe I can get in there and change the laws and invest in public health again and help my neighbors and my family, right?
And help our Republican colleagues see that if you care about being fiscally responsible, public health is a good investment to be fiscally responsible over time. And so, yeah, I think we're missing public health representation. I know Representative Garcia Wilburn has some background there, but I think the more public health representation we can get, the better.
I want to just talk about what has happened to Indiana over the last 20 years and the types of people that are running the show in Indiana is really interesting to me and frustrating to me. Mm-hmm. Since we have a supermajority, that means that the Republicans get picked in the primary, who is going to lead, and the people that run the party in the county kind of have a lot of control over the types of people that are winning. And so in my county, what has happened over the last few years, especially when Obama became president, that's when we really shifted from a Democrat county to a 100% Republican county. We seem to be electing people that kind of have a bully mentality, and they like to act like they're the victims and the people that are being hurt are the problem. And so they like to place the blame on the community members in Harrison County that are suffering, that are working multiple jobs, that can't afford their medicine, and act like they're the problem when they're literally the bullies voting to cut public health, voting to cut services. And then whenever you confront them on it, and you're like, I just want to point out, I don't appreciate that you voted for this bill that hurt. They're like, oh, how dare you? Poor me getting attacked. Oh, it's so hard. It's just like a constant cycle of this. And we're trying to reach our elected representatives in this county and in this state. And it's just this cycle of poor me getting attacked. Oh, and it's like, no, you're hurting us and we're asking you to stop hurting us. And so until we vote better, I think this is going to keep happening.
Well, because they need consequences, right? Like at the end of the day, people in positions of power care about staying in power. And so if they push out bad bills and they don't communicate, we as a people have a duty. Democracy doesn't just happen because you stay at home and you complain about it. We as a people have to show up and we have to vote. And Indiana doesn't vote. Indiana ranks last or second to last. So if you are upset with someone, get to the polls, register to vote, vote in the midterms, vote in the general election. It matters. It works. I think the last year has shown us how much our voice actually matters. I mean, if you told me Indiana, the people would have won the redistricting fight, I would have never believed you. But we did because people organized, people called, people made sure their voice was heard. That is democracy. We do no longer have the choice of not participating and just hoping that things work out. We now have to pay attention. And if someone isn't doing their job, you fire them.
That's the difference that's happened in the last few years. Indiana's gotten so bad. It's caused people like us to run for office, to start their own media companies, to start organizations. There's some great people that started Mad Voters. There's an organization that's my favorite one that's down here that's called Hoosier Action. There's all these great organizations that have popped up to try to hold these elected officials accountable, to try to work with them and encourage them to vote no on redistricting. There are stuff happening. So if this stuff should be working, hopefully it's working and more people are registering to vote in Indiana. They're going to turn out in the primary on May 5th. They're going to turn out November 3rd. Hopefully they're going to invest more in local communities because of all of this organizing, because all of these things are happening. So you give me a lot of hope, because sometimes I get down on how bad our state is. We're building, like just this election from last time, since I ran for state house last time, the difference from then to now is immense. The amount of support, the amount of more great candidates, the amount of work we're doing, putting out the messaging on social media and everywhere about what's actually happening. Hoosier Action, they're down here. They door knock. Did you know that?
I did not.
This group door knocks for an issue. They say, did you know about data centers? And like right now at the State House, they're having a press conference about data centers because that's a problem. Data centers in Indiana, huge problem. And did our government pass one bill to help with data centers? Nope. There were like 17 or something that people made, and they didn't let any of them come through. So they're holding a press conference, and you can go to Hoosier Action, you all, and you can watch that press conference. I think it started at 11. I'm actually going to meet with Tony Hostetler here at, I think, 1:30. I'm doing 2 shows today.
Oh, nice.
Tony Hostetler is from Hoosier Action, and he's going to do a press conference on going to film that. So I'm trying to work with Hoosier Action all I can, because they're doing really good work. They're not partisan. They hold elected officials accountable, and they work with them to try to persuade them to vote better.
Yeah. And I think, and here's the thing, like, yes, we talked a lot today about how bad things are in Indiana, but I do have hope. I really do, because again, the caliber of candidates that are running this year are just incredible. And it's a lot of working class people who are experts in their field, in education, in healthcare, who just want to make a difference for their neighbors and their community members. And that's what we need more of. And so
And you
I
can
do.
work together. Like
Yeah,
the thing that you're expert at, you can help the other people,
right.
teach them. And then the thing that they're expert at, they can teach you and work together to pass laws that actually help us. Amazing. Where is your district? What's your district number here?
So
State House?
District 29, it's
29.
Noblesville. I'm in Hamilton County, so mainly Noblesville and a little bit of Fishers. It's like 3 neighborhoods in Fishers. So yeah, I'm gonna post a ton of events this month. If people are interested in coming out and connecting, I'd love
Is
to.
it, and what's your Kebe for Indiana?
Yeah,
What is
so
it?
on Instagram, Kebe for Indiana 29, and then I'm also on Facebook, Kebe for Indiana, and I'm also on TikTok. I need to get back on my universal healthcare series, though. That one's been harder to keep
You're
track.
doing a really good job with social media of teaching people things. I appreciate what you're doing.
Well, and I
And it,
think that's what's needed, right? Like a lot of people just need to know how the state house impacts all of these other issues that are hitting our local communities. And I think we just think of the state house as something so distant and it doesn't impact us. And we focus more on national news when the local state races have a much larger impact immediately. And so I think it's important to help make that connection for people and be an educator as a public servant, and not just be this distant person that just passes policy without helping people see the impact of it. So
yeah, I'm really big on saving public education because it keep the money keeps being
yes,
diverted to other
yeah.
areas and there's loopholes and people are making
My
money off
school's
of it. And it's,
impacted actually. Yeah,
yeah. And
Noblesville
so,
has been
I would work with everybody.
yeah.
That would be my expertise. I would try to help with public education. And then I would learn from you and from Will and from other people that are good on public health and, you know, like actually pass things to help us. It is possible. I think that we're all hurting in Indiana and we're all feeling it. And if we can keep going and keep organizing and getting the word out, I do think change is possible. So you guys don't forget Indiana, May 5th, the primary. Coumba,
Yes.
you have a primary. I have a primary.
Yes.
Just get out there and research and find the candidates that you like the best and go and vote for them and advocate for them. You can always like help people with their campaigns. If you like Coumba, you can always message. If you'd like to help, we can always use help. And it's really
Just
hard to
vote.
raise
Just
money.
vote.
Everything's hard. Everything's hard. And then vote. And if you can find one person, you're going to vote. Great job. If you're listening to this, you're pretty politically active and want to help the state. If you can get one more person who wasn't planning on voting in the primary to vote. Tim Peck did door knocking, and he said a lot of Democrats were not planning on voting in the primary because they didn't know there was a reason to. They
Oh,
just thought, well, there's barely any Democrats on and they don't have a competition. No, we got
this year's
competition this
different.
year.
We got competition. Yeah.
So we need Democrats to turn out. Republicans, we need you to turn out and go and vote in your primary and research your candidates and pick the ones you think are better. It's important. Yeah. Yeah. Thank you so much for coming on today. I know you're really busy.
No, thank you. I appreciate it. I'm always excited to talk about healthcare and give people a different perspective. So thank you.
It's important. Thank you everybody for listening. I will be back on at 1:30 with Tony, and that's going to be more about he's in the Care Not Cuffs chapter of Hoosier Action. So he helps people with recovery, people that are getting out of jail. So it's pretty fascinating stuff. I really like Tony and appreciate what he's doing. So join us for that if you want, and just have the best day, Coumba, and good luck with everything and keep in touch. And I'm proud of you, girl.
Thank you. Thank you. Proud of you. Good luck.
Yeah, thanks. Bye everybody. Have a wonderful day.